Welcome back, guys. This is Dr. Mike. Today we're going to talk about 3 exercises that you can use to help decompress your lower back. So if you're dealing with numbness or tingling down one leg, some tension or pain in the lower back, or even just feel like your back needs to just be decompressed after a long day, I'm going to show you 3 things that you can do at home to help decompress that spine. Let's get started. So one of the first ways that we can decompress our back at home is just by laying down on your backside. And what you're going to do is actually you're using your hands and you're placing them over your thighs. So you're in this hook line position, kind of like in a bridge position. You're going to be laying nice and flat. If you cannot reach your thighs, you can also place a pillow on top of your thighs so it elevates your knees so they're a little bit higher. And what you're going to do is you're going to use your hand to put pressure down into your thighs, almost as if you feel all of your abdominal muscles kicking on, and you'll feel a slight decompression of the lower back there. You don't really have to give your maximum effort here, but just enough so that you can feel some pressure relief in the lower back and hopefully feel some pain relief there. So just think about taking those hands, placing them over the thighs there, pressing down into the thighs, and start to feel your abs working, but also the lower back decompressing. The second way that we can decompress our lower back is we can simply lie on our stomach in a prone position. I've shown you this in a previous video. If you check out my sciatica pain relief video, this is also a technique that's used to relieve any numbness or tingling down one of the legs, okay? So what you're going to do is you're going to be lying flat in this position here, okay? Now the further that you start to press up in this position, the more extension your spine is getting, hopefully creating more decompression at the lower back. So when you're starting off with this exercise, you might want to start off with just seeing what it feels to just prop up on your forearms right here. Also notice my arms are underneath my shoulders. I'm not kind of spread out like this, and I'm not too far in with my forearms. So I'm just stacked as best as I can underneath my shoulders with support. Now, if this is too easy, what you can do is you can really start to feel some decompression by keeping your pelvis down on the bed or on the floor, and you're pressing yourself up. I like to even squeeze my abdominals and squeeze my butt so that I'm not letting my pelvis lift off the surface there. And what you should feel is some nice pressure relief on the lower back there. If any of these cause more pain or more numbness and tingling down your leg, please stop and maybe try the next exercise we're going to go over. The last method we're going to use, you can perform this standing, and this is by far one of my favorite exercises because you can actually do this anywhere when you're walking in a park. All you really need is to find a hard surface like a bench or something that you can prop your body up, and I'll show you in a minute. So what you're going to do, you're going to be standing up in this position. You can either choose to place your hands with your fingers facing forward or behind me, and what you're going to do is you're going to allow your upper body to support your spine. My legs are still underneath me, but now I'm feeling a nice pressure relief or tension relief in the lower back there, and I'm decompressing my lower back as I'm just supporting my upper body. So I almost feel like this traction, this pulling on the lower back. It's almost as if the vertebrae are moving away from each other. We're trying to create a little bit of space in between. And so you can do this, once again, either out in the community on a bench, nice pressure relief there, to see if that gives you any relief there, okay? Now, to get a good assessment to see if this is actually working for you, you can work on this for about 2 to 3 minutes at a time. If you're finding relief or it feels pretty good, more than likely it's okay. But if you start to experience more numbness or tingling or maybe some more pain with it, just completely stop the exercise. Guys, thank you for watching today. I really appreciate you for stopping by to watch this video. If one of these techniques was helpful for you, please support my channel and to help me grow so that these videos can reach a larger audience. If you hit that like and subscribe button, I would greatly appreciate this. And if there's a topic that you specifically want to hear about, please make a comment in the comment box and I will get back to you and work on that video for you. Thanks again for stopping by. Hope you have a great day. Take care.